Most people think mental health only involves people in mental institutions and prisons, veterans and drug addicts, but it doesn't. I have anxiety, and maybe the person I'm sitting next to on the train has something too. A lot of people do. But it doesn't stop us from living. Plus, there are people out there who can help, whether it's on the scene or at home. There are also people who try to help others understand. We're not alone. We're never alone.
I'm not afraid to talk about it because it is what it is. I mean, we're not going to say there's a problem, but we work with it as a family, friends, or we just work with it.
I have a borderline personality disorder, and it's okay to be part of society and to be like everybody else.
My dad has kind of come around since I've been diagnosed. He's been a lot better supportive. He's been much more supportive. He's been more understanding. He's now a really good ear if I'm not feeling that great.
It's okay to talk about problems. It's okay to talk about your own psychology, your inner psychology, and it's okay to be open about it. And I think that way everybody would understand that there is no problem with having problems, psychological problems.
It's great that the stigma is more widely acknowledged now, but I think that even if you acknowledge it, it's still very present and still creates a lot of barriers.
It's going to be hard, but we can do it. We can make a way. We got this far, we can get farther.
What is mental illness? According to the National Survey on Drug Use and Health, a serious mental illness, or SMI, is a mental, behavioral, or emotional disorder which, unlike a non-serious mental illness, results in serious functional impairments that greatly interfere with major life activities. Blue Cross Blue Shield lists examples of SMI, which include schizophrenia, paranoid and panic disorders, bipolar disorders, major depressive disorders, obsessive-compulsive disorders, PTSD, pervasive developmental disorders such as autism, bulimia, and anorexia.
My name is Teresa. I'm a school aide for 6 years, and I have a son that's 19 with autism. He's severely autistic. When I first heard autism, I was like, what is that? Now I could tell you a lot of things about autism because I've learned it. I lived it. I'm living it. My opinion, the way the general public feels about mental health, is some people are very, very heartfelt, warm about it. And some people are very, very ignorant. They stare at a child or an adult when they know they have a problem. It puts a lot of people in a very uncomfortable position. And me as a parent of a child with mental illness, I put up my walls. I'm going to be his voice. I'm going to be his power, his strength, whatever it takes. Because some people could really, really put a scar on you.
Before I was diagnosed with an anxiety disorder, I did kind of have the stigmas surrounding it a bit. Like, I thought people in therapy were like absolutely crazy, but I also knew, because I wanted to study psychology, I knew that those stigmas weren't as true as the rest of society generally believes them. And I did think that therapy and counseling were kind of good ideas because I hung out in my guidance counselor's office all the time. So I knew the benefits of that, and I liked talking it out. I was kind of surprised by my family's views of mental illness when I was diagnosed because they do buy into the stigma, and it's been 2.5 years now, and they still do. Like, my mom will always flat out tell me, I don't think you need to be in therapy. I don't think you need medication. I don't see why you need it.
Physical and mental is the same thing to me. If you can't do anything mentally, it's just as bad as you can't do something physically. Like, if you're really depressed, you're not going to do anything. You're not going to go outside. You're not going to even want to brush your teeth. It's just like if you have a broken foot. You're not going to be able to walk without your foot.
1 in 5 adults in America, approximately 18.5%, live with SMI. For youth, ages 13 to 18, it raises to 21.4%. For ages 8 to 15, the number is a bit lower, at 13%. According to the World Health Organization, mental health is the second leading cause of disability and premature death in developed nations. It can result in homelessness, joblessness, and social isolation. For kids, it can disrupt education and destroy peer relationships.
I feel public schools are handling mental health issues on a scale. Some schools, I think, handle it better than other schools. I don't work in all schools, but I do work in a school, and my son goes to a different school. And I think the way they're handling it, it depends on the staff. If you have staff on top of a child, then that child is always going to be safe and secured. If you don't, then there's issues that are going to happen. So I don't think the public schools are actually all as one weighing at the same thing. I don't.
Last year, I wrote a whole big research paper about mental health facilities in New York City public elementary schools. And mostly what those facilities are satellite clinics, so like local hospitals or healthcare providers will open a clinic within the school, and they'll operate as like a branch of that hospital or office or whatever within the elementary school. And what it really comes down to is that there's a lack of funding for these programs, because insurance companies are shifting from fee-for-service plans, so you go, they take care of you, and then you just bill the insurance company. Now they're switching to network plans, so each hospital or satellite clinic has to be part of an insurance network in order to get paid for that service. But there's all these problems.
Nationally, mood disorders, including major depression, dysthymic disorder, and bipolar disorder, are the third most common cause of hospitalization in the U.S. for both youth and adults aged 18 to 44. Adults in the U.S. living with serious mental illness die on average 25 years earlier than others, largely due to treatable medical conditions. Suicide is the 10th leading cause of death in the U.S., and this is the third leading cause of death for people aged 10 to 24. Economically, serious mental illness costs America $193.2 billion in lost earnings per year. New York City itself has a large number of residents with SMI. According to NAMI, of New York's approximately 19.5 million residents, close to 673,000 adults live with serious mental illness, and about 204,000 children live with serious mental health conditions. In June 2015, NYC Vital Signs conducted a study comparing New Yorkers with SMI to those without. Their findings showed those with SMI to be at a disadvantage. For example, they are more likely to report fair or poor general health, have high cholesterol, or be a current smoker. Most of these statistics show that those with SMI are almost 2 times as likely to have this be their way of living than those without SMI.
I absolutely do not think it's easy for people with mental illness to find healthcare providers that can take care of them. I know when I was first diagnosed, I was able to get into the counseling services at school, and that took care of me for a while, but then I needed to be referred out because I was on medication, and that wasn't something school could handle. And when I started trying to find a therapist last year, a lot of people were just really busy and they weren't accepting new patients at this time, and it was really kind of a letdown because I'm like, I need this treatment and I want to get into it as soon as possible, because if I go without it for too long, I know things are going to get worse for me.
Because I think this government, the whole program for mental health is really on the back burner. I really don't think it's priority. Nobody tells you what to do. You have to kind of learn this on your own. The government doesn't tell you this. Like, you have to go and research this or talk to people who are in it to help you, because nobody tells you nothing. You know, I can't call up the government and say, or, the office and say, can you tell me how do I go about a severely autistic child, nonverbal? And no, they don't tell you nothing.
The way I see it, New York ranks behind other states. It does try, obviously I'm coming from an experience working with youth and college age individuals, but ultimately there's just not enough support on campuses. In New Jersey, for example, they just passed an act to help support students as they come into college and as they transition and then throughout their experience, because college students are, as you might know, one of the most, they experience some of the highest rates of things like suicide, depression, anxiety. So New York has not been the leading state when it comes to policies regarding youth and college age mental health, but we're working on it, and New York City's initiatives especially are starting to change now.
This isn't to say that the New York government has forgotten about those who suffer from SMI. In 2002, Governor Pataki and the OMH issued the first thorough mental health analysis of New York City, dividing public mental health into 4 categories: emergency, inpatient, outpatient, and community support. It also outlined his new initiatives for mental health, which provides for over $125 million in new funding for community support services that have been effective for adults and children. Services for the families of those with SMI, assisted outpatient treatment, and supported housing. OMH is a major provider of inpatient and outpatient services and includes more than 2,500 mental health programs operated by local governments and nonprofit agencies. They have 17 psychiatric centers for adults and 6 for kids that provide both intermediate and long-term care. State-operated inpatient services are all regulated. There have been many improvements made: safer environment for patients and staff, reduced use of restraint and seclusion, and increased access to the most effective medication.
Well, inpatient services is when we want to keep the patient there for a pretty extended amount of time so that we can give them the right care and we can hope to relieve any illnesses they may have. Sometimes it may result in a hospice care. It would depend on the patient and their progressive disease or illness. As for the outpatient, we want to get them out as soon as possible because as soon as they're in the hospital, we're already thinking about discharging them. For that, we'd like to keep it that way because we don't want to keep a patient in the hospital for too long. We don't want them to suffer or maybe accumulate, pathogens and such.
State-operated outpatient services were majorly reformed in 1996. They now stress a person-centered philosophy of treatment, have fixed monthly rates per person that covered all services delivered, have a comprehensive benefit package that includes treatment, rehabilitation, support, and self-help services.
Patients who are not staying long in the hospital have been getting more help finding outpatient services. When they don't have the family support systems at home or access to resources to get help, it's up to the nurse and the hospital to arrange the referrals and get them in touch with the right people who can help them. They all work together. So when we think about mental health centers, we have to remember that it may be associated with a hospital or be an independent agency. They can be crisis-centered or involve long-term counseling. These services include interventions, individual and group counseling, medications, assistance with independent living. There are also 24-hour services and hotlines for people who are suicidal, abusing drugs or alcohol, or even abusive situations.
In 2006, 69% of New York State mental health agency spending was on community mental health services. 27% was spent on state hospital care. At the time, these percentages were close to the national averages of 70% and 28%. However, this only led to New York's public mental health system providing services to only 57% of adults with SMI living in New York at the time. Luckily, this is a far cry from how New York used to handle mental illness. Harlem Valley Psychiatric Center was the state's answer to mental illness until the 1960s. They housed up to 93,000 patients and were the first American asylum to use insulin shock therapy in the 1930s and one of the first to introduce electroshock therapy. The center was eventually closed down in 1994 after the state and city found money to build new community residences and hospitals were pressured to make more efficient use of their psychiatric wards in the 1980s.
In the 1960s, it was very hard to get treatment. And I don't think there was too many places around. Well, at least we didn't know of any. I only know about my friend who had a nervous breakdown and was in Elmhurst Hospital. And it was a very hard time, and we had to try to get him out and put him into another facility, and they were treating him. And I know that he had electric shock treatments, and I don't know, I think he was diagnosed as a manic depressive, and he had to be on medication for quite some, well, I guess most of his life.
I've been taught to handle patients with mental illness by always making sure that they're receiving the right care by my professor and my peers. So when we were handling medications, we were expected to know the medication they were taking and if it was appropriate for them. So my professor asked me to look up the medication that he was taking, which was Haldol, which is an antipsychotic medication. It sounds very maybe blunt, but that's basically what it is. We also have to look out for other things so that we can assure that the patient is safe at all times and mentally stable.
New York hasn't only improved their treatment of those everyday citizens with SMI. We have also made waves with our improved treatment of those with SMI in our jail system. In March 2011, Mayor Bloomberg sought to develop and implement data-driven strategies to improve the city's response to people with mental illness in the adult criminal justice system. In particular, the city wanted to understand and address how even as crime in New York City has decreased and the jail population has declined, individuals with mental illnesses still represent an increasing percentage of the city's jail population. People with mental illnesses booked into the DOC had consistently longer lengths of stay, on average 112 days, compared to those without mental illnesses who stayed an average of only 61 days. The reforms instigated by Bloomberg are used to determine levels of risk and needs for individuals entering the DOC in order to identify appropriate considerations for community-based supervision and treatment or alternatives to incarceration.
I'm Neha. Right now I intern at the Attorney General's office for New York State, and I am a litigation bureau intern. With one of the cases, one of the criminals was not getting adequate mental health treatment. So we have a mental health department within the litigation bureau. And basically what their job is to tell the prison, like, okay, this is what you did wrong and how you're gonna fix it. And so a lot of law that I've been seeing recently has been dealing with how mental health has been criminalized. So you have a lot more programs in place within facilities where people can get sent rather than just jail. They have like certain time that they're spending at like a special housing unit where they're being treated for those facilities, getting medication, all of that. So that's pretty interesting.
More recently, different agencies have been working together to help those with SMI. The New York City Mental Health Care Monitoring Initiative provides teams run by the OMH and the New York City Department of Health and Mental Hygiene that aid providers in identifying those disengaging from services and support outreach strategies to re-engage and sustain these vulnerable people in care. It was launched in Brooklyn in 2009 and implemented citywide in 2011. Our current mayor, Bill de Blasio, has also shown himself to be an advocate of those with SMI. The goal of New York City Safe, a $22 million mental health initiative, was to aggressively reach mentally ill people prone to hurting themselves or others. Various agencies, including the Department of Homeless Services and the New York Police Department, will share information with one another about those people to make sure they are being treated. About $5 million of the funding will go towards increased security around and inside some homeless shelters.
Our mayor, Bill de Blasio, and his wife actually have both shown a commitment to this issue, and one of their most recent initiatives is to, in the hopes of reaching people with serious mental illness, they're working to put $22 million into the city's response to these issues, and they're working with the police departments as well as the Department of Homeless Services.
My name is Matt, and I volunteer sometimes at a soup kitchen. I think from what I've seen, New York's homeless population, a large chunk of it is the mentally ill. I think there are other huge chunks like families and just people who, unfortunately, like new homeless, who have just been impacted by financial issues and can't afford a place, especially in New York City, where like rent's like so high in certain areas that you just, and there's too many people that you can't afford a place in the city. so you're just stuck on the streets and you can't escape. I think the soup kitchens themselves are a great place, just human interaction, talking to people can help with some. And there are social service programs that some soup kitchens offers, like the one that I go to. There are social workers come in and they help just people get the medical help they need, if any they need, and just try and help them make their lives easier to live with.
Like just finding more places for us to go, like housing. It's a really bad shortage of housing right now, and I think we need more, more apartments, more shared apartments, more independent living if needed.
However, it is not only government agencies that have the power and the responsibility to look out for those with serious mental illness. It is the responsibility of every citizen, every New Yorker, to look out for those with SMI and to galvanize a positive and supportive attitude and atmosphere towards them. You can do this by raising awareness about the stigma on mental health, or by becoming an active member of groups such as NAMI, which serves as an advocate for those in need.
I also joined a club at school called NAMI on Campus. It's like an offshoot of the National Alliance on Mental Illness. So what we do is we're trying to raise awareness about mental illness within the community at Hunter College. And we just do a lot of promotion and advocacy. We also promote the counseling and wellness services at Hunter so that people know that they're out there in case people need it.
Well, we work with our local NAMI affiliate to host educational events and spread awareness as well. Last semester, we had a very successful finals week event where we gave out free coffee and donuts in exchange for a positive note. And then we hung them around the school to lift spirits during finals week. We also hosted another event, which we brought therapeutic puppies into the school. We are participating in the NAMI Walk, which is to support our local NAMI affiliate, and we're also fundraising for the organization.
Today I'm working for, of course, anybody suffering from mental illness, but also their family members. I myself have family members suffering from mental illness, and I've lived the illness through them. And I'm happy to give support in any ways because I think they really need it, deserve it, and I also admire them to see how far they can go.
I go to a center, like the New York Pedestrian Center, so that's why I'm here today. They wanted the whole group to be part of it, so I do have mental illness, so I'm here to support myself and the group.
But I think in the United States, compared to other countries, all the efforts and advocacy of associations like NAMI are making a difference. And I think this stigma is decreasing lately, especially in people with education. Sometimes people stigmatize mental illness, saying, "Oh, that's like crazy people" and things like that. But most of the times, people with more education, they see counselors, they talk to counselors, and we psychiatrists, we do counseling and we do psychoanalysis, and we learn about ourselves through therapy. So therapy now is seen as something that is good for everyone. You don't need to have mental illness to see a psychiatrist or a therapist, and I think that's changing the perception of the way people approach mental illness.
The stigma on mental health has been prevalent in most of our lives, but it doesn't have to be. With the help of like-minded individuals and fellow advocates for mental health awareness, we can erase that stigma and create a society where everyone accepts that mental health is just as important, if not more so, than physical health.